the PowerPoint.
I do, John.
Okay, you
Go ahead.
guys, thank y'all so much for joining us. There are 75 people here, so great. You all got to see my technical difficulties this afternoon, but my name is Melinda Plew. I am with the Advocacy Division of the ARC of North Carolina. We are so happy that you took the time to join us either for the first time or the second time in a week's time during this very interesting period in North Carolina Medicaid. We are changing over to something called a tailored plan, and that is confusing to a lot of you families, and you may be with a provider organization. And so we wanted to give the opportunity to explain it a bit, but also take questions from you. We did this last week. Thanks for those of you who showed back up. I did capture the questions that were asked last week that we didn't get to. So feel free to ask them again, and I have a list in the background of those questions. We're going to ask that you don't use the chat, that you use the Q&A, and that is how we will keep ourselves organized. Yes, this is being recorded. Yes, we will translate it into Spanish and post on our website and on our social media. And we will continue to engage with you if you have further questions. But with that, I want to introduce John and Lisa. John is the Executive Director of the ARC of North Carolina. You will see his picture. Hopefully you'll be able to see his face in just a second. And Lisa Petit is Deputy Director for the ARC of North Carolina. And Lisa is going to share her screen, and we are going to get going. Thanks, y'all.
So Melinda, help me. I'm trying to share my screen, but I don't think it's giving me the option to share my screen. Oh, hang on.
Yeah. So while they're doing that, just quick commentary for all of you. This is in the same format that we've done multiple videos in the past, webinars. The intent here is to be as plain language as possible. We don't have all the answers. There's a lot of things that there may not be answers for, but we will do the very best we can. Please, if we happen to slide into techno speak or gobbledygook or terms that you don't understand, acronyms that we use every single day in the world that we have to navigate, but that may not be used in your world, call us on that. And we are not offended, not bothered. And matter of fact, I would prefer that you all ask us to define an acronym, even some that
Did we lose John?
There we go.
Yep.
There we go.
Oh, Melinda, you just need to let me use my video now.
Figured it out. There you go. Sorry, John.
Not a problem. There we go. Anyway, just to make sure that you all are aware, this is intended to be plain language, simple, easy to understand, and hopefully if we don't have answers, we'll do what we can to find answers for you. So with that in mind, let's go ahead and walk through the webinar, and I'll let Lisa go ahead and get started.
Most days we find Zoom technology a little bit easier than tailored plans. I'll start off by saying today we got a little bit messed up. So here's what we're going to do today. Talk about tailored plans, the difference between tailored plans and tailored care management, explain some of the materials you might be receiving in the mail, talk about next steps, and hopefully answer some questions that you all may have. So what is a tailored plan? I'll start with this one. You all may remember when the state launched standard plans a couple of years ago, and that was for the bulk of the people who receive Medicaid in the state. They move under standard plans, which are managed care health plans. This is health insurance stuff. The tailored plan was reserved for people with more intense needs, and this is the health plan that it will now launch on July 1st for people with intellectual and developmental disabilities, traumatic brain injuries, mental illness, and substance use disorder. And in the tailored plan, each of the LMEs will provide the tailored plan as a health plan and provide the services under that tailored plan. Again, this is managed care, so it is the state's goal to help manage all of these services under this health plan for Medicaid recipients. Tailored plans will be run by the LMEs, and we'll talk more about that as we move through this.
So just so we're clear, LMEs, these are the funding agencies that you all work with. Alliance, Partners, Trillium, and Via. Those are the four that remain. And again, they are now the funding agencies that funnel all the Medicaid dollars from the state to serve you locally. On July 1st, they are going to also become, in addition to that funding agency, they're going to become insurance plans handling Medicaid insurance. So it's on the outside to the end user, it might not look very different. On the inside, behind the scenes, it's a lot of difference. And so there's been a lot of moving parts, which is why it's taken so long to kind of get all these pieces together. The service and the activity that it does, we've been doing that since last October. Beginning in July 1st, they're going to be additional pieces come to this. And so you're going to get some information. And that's why we're doing these webinars, is because we know you're going to be getting information, and it's going to be confusing. And we want to make sure that we give you an opportunity to at least ways be aware of what's coming and know how to handle that. All right. The reason why they're doing this goes back into the deep, dark history. Originally, it was intended to give the state the ability to manage the dollar. It wasn't supposed to save money so much as it was to be able to say, we know exactly how much we're going to spend every single month, which in the olden days, back 10, 15, 20 years ago, that was much more complicated, and the dollar amounts could be very different month in and month out, and that's hard to budget for. So managed care, and this is a national thing, managed care came along to help manage how much money was going to be spent. And even though it might even be a little bit more expensive, it was easier to manage because you knew every single month how much that cost was going to be, and you could budget for that. Under this new plan, and we've been doing a modified version of managed care for quite some time. If you're familiar with the Innovations Waiver, or you're receiving Medicaid waiver type services through for behavioral health, habilitative health, long-term services and supports. If you have intellectual developmental disability and you're receiving those resources, that funding is going to now expand to include not just your day services and supports, habilitation, jobs, employment services, all those things that have gone along with the work that we've been doing for many years. It is now going to include under that umbrella all of your healthcare. So the intent, the idea is we are working with the whole person. We're not just saying, hey, what's good for you as far as your day services, but we're not going to look at anything that affects your health, like your diet or your lifestyle, the things that are helpful to you health-wise. Maybe you need to have a breast exam, or maybe you need to have cancer screening and different kinds of things that we do just to protect ourselves health-wise in our world, in the community of people with intellectual developmental disabilities. Those things go hand in hand. And so the intent of all of this is to bundle them together, have a single point where we can work with you and connect all the dots so that you get what you need to be able to improve your health and your circumstances.
So this is happening July 1st. The tailored plans will launch. And right now we're in the middle of a choice period from April 15th to May 15th. The choice period is where, and you may be getting mail about this, where you're going to be asked to choose a primary care physician that is in the network of your LME MCO. We didn't explain all those letters. Let me back up for a second and do that. LME is local management entity / MCO is managed care organization. Again, this is going west to east via Partners, Alliance, Trillium. You're probably used to hearing those four names. If your doctor is in their network, you will be able to choose your doctor during this choice period. You will be asked to call your LME and make your selection for your primary care physician. That you have until May 15th to do that. On May 16th, if you haven't made your choice known to the LME, they will choose for you and they will assign you to a primary care physician who is in their network. So you've probably received a letter about this. Please don't throw that away. It could be complicated. There are a couple of things you need to do. We've actually put together a step 1, 2, 3, 4, one pager kind of document that I think Melinda's going to email out to everybody afterwards, that just walks you through these steps. You call the LME's number, which we have on the document we're going to send you. You tell them which doctor you want. You give them your name or the Medicaid member, your family member's name, date of birth, Medicaid ID number, Social Security number. They log all that in the system. They give you a reference number, which you're going to need to keep, which points you back to the call you made to choose your doctor. And we encourage everybody to choose during this choice period so that they won't choose for you. You want to say in having who your doctor is going to be. So make that choice now before May 15th, or you will be assigned to someone by the LME MCO system. Let's talk a minute about care management. And these terms get confusing. There's the tailored plan, which is, think health insurance plan for people with Medicaid. And then there's tailored care management. And I'm going to shorten that to just care management because it's easier to define the two separately. Care management is a critical piece of the tailored plan that's launching in July. Now, care management launched in December of 2022, so we kind of got a head start with care management. And care management's a critical piece of this health plan because your care manager is the person who is supposed to make sure all of these services are integrated together. So as John mentioned, we're talking about your community-based services, the support you may receive at home or in your community, plus now add into that medical services, doctor's visits, pharmacy services to make sure the medications are correct and you're not receiving medications that don't make sense for you. I would add to that, tailored care manager or a just care manager can also assist with school-related issues. It can assist with IEP meetings, for instance. If you're receiving supported employment from VOC Rehab, they can assist with helping to coordinate that. And the idea is to make sure it all fits together well and everything is working in your favor in the best way possible. So care management is automatically available to all people who are in the tailored plan. It's also available to people who will remain in what's called Medicaid Direct. So if you're not receiving, if you're not moving into the tailored plan part of the LME, you will remain in Medicaid Direct. You're still eligible for care management. And we really encourage people to consent for care management, check the box that says, yes, I want care management, and use care management to help, again, coordinate all of that stuff in your life. We know that a lot of family members and a lot of direct support providers have been doing this kind of navigation and managing services for a long time. Now is a chance to get some help with that. So if you think it would be right for you, we encourage you to try it out.
In different parts of the states over the last number of years, we've had a service called Community Guide, Community Navigator, and that's been an ongoing thing. Those services were discontinued for the most part, not completely, but for the most part, particularly if you're on the innovations waiver, they were discontinued because care management does everything that Community Navigator and Community Guide has done in the past. And so if you're used to that support, helping somebody helping you connect the dots with whatever resources you need, that care manager is going to do all of that, including connecting you with your health resources. And there's a couple of questions along those lines that popped up in the chat. If you choose a primary care physician and you want to change, there is a no fault twice a year. You want to change for no reason other than I like the color of the building, the doctor I choose, or I don't like the color of the building, my current primary care physician. You can change twice a year for no reason other than that it suits you and that's what you want to do. You can change as many times as you want if there is justifiable reasons. And it could be anything. My doctor moved, my doctor closed his practice, my doctor has a malpractice lawsuit. I mean, there could be lots of reasons justifiable, and that can happen as often as you want. Your care manager will be there to help support and help you with that transition and making and connecting those dots with where you need to go and helping you find a new doctor. That's part of the role that that care manager does.
Got to talk through this. I guess I kind of got ahead of myself here. What about the doctors? Choose your doctor.
Yep.
Choose your doctor before or by the end of the day on May 15th. I would add to this, if your doctor is not in network now, that's okay. It doesn't mean you're going to lose your doctor. Doctors are being recruited heavily right now to join the tailored plan, to contract with the LME so that they will be in the network for their tailored plan when it launches. They're adding doctors every day, as well as hospitals and big systems. And they might be adding single doctors or entire practices. Keep that in mind too. There's several ways to get into a contract with a tailored plan. If your doctor is not in network with your LME MCO tailored plan, you can still see your doctor, and your doctor will still be paid by Medicaid for those visits. Doctors will have an extra 90 days to sign up for the tailored plan. And still be able to receive the tailored plan rate, which is a little bit higher than the regular Medicaid rate, to entice them to sign up. And then from what we understand, there's, after that 90-day period, there's an additional 121 days after that they will still be able to receive that higher rate and have the opportunity to sign up with the tailored plan. They can sign up with the tailored plan whenever they want to. They could do that a year from now if they choose to. There will be some doctors who choose not to. And if that happens to be your doctor and they never ever sign up with the tailored plan, you can still go to that doctor. They will just receive 90% of the Medicaid rate instead of 100% of the Medicaid rate through the tailored plan. So if they're willing to see you at 90% of the Medicaid rate, you keep right on going and nothing changes, and Medicaid will still pay for your doctor. There have been a lot of questions about people losing their doctors. We think that is calming down quite a bit because so many doctors now have signed up with tailored plans.
So last week, in the same webinar we did last week, actually 2 individuals came back with a question. One person came up with the question, my primary care provider tried to sign up and was rejected, was denied. And somebody else chimed in on the chat and said we had the same experience. We're still looking into this. We're trying to find, there may be a lot of reasons why, technical, who knows, there's a lot of things going on, and that's a more complicated question. My recommendation is to you, stay tuned. We're still looking into this and trying to get some answers. And this has been several conversations so far this week, but we also recommend that you contact the North Carolina Department of Health and Human Services Ombuds Office. The ombudsman's job is to make sure that those kinds of things are addressed and to facilitate, if there's a doctor out there that wants to sign up, and believe me, particularly for the community of people with this intellectual and developmental disabilities, we want doctors and we need doctors. And oftentimes our doctors aren't part of the big networks that other doctors in the other parts of this, mental health and substance use, they're not part of those big conglomerate networks. Some of them are, but there's definitely some that are not, and definitely our specialists are harder to get connected to that. And so to the degree that if you have somebody who says we signed up and tried to sign up for Medicaid services to take care of our patients and they were rejected, call the ombuds office. And if you're still having issues, let us know, because we'll follow up on it as well. I mean, we're more of an informal and have informal ties backwards through the department, can ask questions. The formal approach is get their name on in front of the ombuds office and let them see about making sure that that doctor had every opportunity. And if there's a reason for them to be turned down, that it is a very legitimate and a good reason. And again, we're looking to not reject doctors today in this environment by any stretch. So.
Well, if you got a letter from DHHS and you don't understand it, or you even threw it away, lots of people get lots of letters or long multi-page packets from DHHS that there's a lot of stuff in there that most people don't understand. Some people do toss it in the trash can. We'd encourage you not to toss it in the trash can, first of all. If you throw it away, I'd suggest you call the LME and ask what information you need. If you have a letter and you need help interpreting that letter, we're happy to try to help you with that. The letter likely says, and we don't have a copy of it with us today, but from what I understand, it's around page 3, and it likely gives you several steps that you need to implement now. It's basically, again, about choosing your doctor. Decide what doctor you want to use as your primary care physician. Call the LME, choose your doctor, give them your choice, tell them which doctor you want to use. If they say your doctor is not in network, understand they're going to assign you on the 16th of May someone who is in network, and you can call back later and choose a different doctor. So if you have a letter, it's likely got those few steps in there, and you just need to follow those steps during the choice period, again, which ends May 15th. Make sure you choose your doctor by then. Right now, I'd say read that letter, choose your doctor by May 15th, and get answers to your questions. Here's the ombudsman's information. There's a phone number, an online portal where you can submit questions or issues, and an email address where you can do the same. So I believe this is our last slide before we're taking questions. I'll leave this up for a little bit. And Melinda and John, since I'm sharing my screen, I can't see the chat. I don't believe so.
So I've got the questions, and let's just go through the and you guys are great. Continue to put your questions in the Q&A. We're going to run through them one by one, and then I'll get to the ones that we didn't get to last time. Before I do that, do you guys want to address dental? Because we always get questions about how does this affect my child's dental care, tailored plans.
Yeah, dental is carved out, which means it is not included in the tailored plan. So dental services for you should not change. If your Medicaid is paying for dental services, that will continue, but it will not be a part of what the tailored plan helps to manage. Now, I would address care management separately, because a care manager can help you find a dentist, could help you schedule an appointment, could help you get transportation there, could help you understand what your dentist is saying, what your dentist needs to do, can help with a lot of stuff. So within care management itself, you can have that care manager help coordinate dental services, but they are not, the dentist will not be paid through the tailored plan or through this health plan yet. I will say there is a lot of advocacy around the state for dental to be brought into that tailored plan and coordinated with everything else. But that hasn't happened yet. That will take some legislative action, and it's probably a year or two down the road from that happening.
Okay, first question in the queue is, can people that do not have Medicaid have a tailored care manager?
No, that is a Medicaid service for Medicaid recipients.
My son has been receiving care for many years with Duke Children's Hospital, mostly for cardiology. How will this impact his services? Does Duke accept Trillium?
Duke has not yet signed on with Trillium. They are trying to work through some contractual differences. I would encourage you to advocate with Duke to get that contract done. And otherwise, Duke will receive the same Medicaid payment they've been receiving for those cardiology services.
if you choose a PCP but decide to switch doctors months from now for whatever reason, is that going to be a possibility by just calling and changing it?
Yes.
Yes.
Twice a year, you can change your primary care physician for no reason other than you want to change your primary care physician. And that's ongoing year in, year out. If you want to change twice a year, every year, that's your prerogative. Again, you can change as many times as you want. There is no limit if there is justifiable cause, and we'd have to get into the regs and what is justifiable. There's no need to go into that here, other than to be aware that you have a lot of options and a lot of choice that you can make. If you need to change your doctor, you can change your doctor.
So Marilyn has clarified her question, and this is why it's confusing. If you don't have Medicaid, do you qualify for a tailored plan? Before she said care management, and that's why it gets a little confusing.
Yeah, it's still no, you do not. Tailored plans are a health plan for Medicaid members only.
And maybe Marilyn can clarify even a little bit further. If you are Medicaid eligible, but you have not signed up for Medicaid and you're not receiving the Medicaid Innovations Waiver Services, and there are people that are receiving Medicaid support, they may qualify for a standard plan, which is the more basic version of this. Or if there are, if you would qualify for the waiver, but you just have not received it yet because you're on the wait list, you're not getting Medicaid services today, but you qualify, then yes, you could. So it just depends on where you happen to be in the process. If you are qualified for Medicaid services, but you have not signed up, we suggest you sign up, because that opens up more doors and more options for you as you go.
What if your current primary care provider is not located in your county? After 27 years, we will not go to a new doctor in our current county.
So I saw that question when it popped up, because that has been part of our conversation with all the different parties that we work with, and to remind them that every one of the LME MCOs lives within, give or take, a 4-hour circle of anywhere in the state. And that means that if you live in one LME MCO catchment area, potential is you could have a doctor, or you could have people coming to doctors from all over the state, and you would reasonably need to be able to provide for them. And that is unique to the IDD community. When we find a doctor that serves us, we tend to send the word to those that we know, and it's a pretty, we're spread out, but we know each other. Word gets out that there is a doctor that works with this particular condition. Pretty soon, other folks with that same condition from all over the state start going to that doctor. That being the case, if you have a doctor that is outside of your catchment area, that's not a problem. If they are Medicaid eligible and they've signed up with Medicaid, you should be able to go to your PCP, your primary care physician that you have chosen.
Can your care coordinator?
Can I add one?
Oh,
Let me
sure.
add one thing to that. These LME lines, regions are very strict. Let's take Alliance and Via, for instance. Just above Raleigh, the counties north of Lake County, Alliance bumps up to Via. If you're living in Franklin County and you're seeing a doctor in Wake County, your doctor in Wake County may be signed on with the Alliance tailored plan, but not the Via tailored plan, or vice versa. If it were me, I'd be calling my doctor saying, which tailored plan are you signed up with? Are you signed up with all of the tailored plans? Because as people move around the state, it is ideal if doctors sign up with all 4 tailored plans. If they don't sign up with your tailored plan, your LME can do a 1-person contract with your doctor. Now that's a lot of work for 1 person. Doctors are not going to want to do that. So I would, again, you might be in a place where you can advocate for your doctor. Please go ahead and sign up with the tailored plans so that we can continue to use you and you get paid the higher rate.
Yep.
It's a conversation worth having if you're concerned about that issue. Thanks, Melinda.
Yeah, sure. No, rolling through this. Can your care coordinator select your doctor?
No.
Okay.
Neither can your care manager. That's supposed to be personal choice.
Yep. Maybe you will get to this, but I hope you can explain if there's a difference in the tailored plan for people who are dually eligible and have innovations waiver.
Yes. So if you're if you're receiving the innovations waiver, you are automatically moved in the tailored plan. That process is actually already started for people on the innovations waiver. If you're not on the innovations waiver and you are dually eligible for Medicaid and Medicare, you will remain in Medicaid Direct. You will not move into the tailored plan yet. That may come down the road, but they will keep you out of the managed care model of the tailored plan for now, if you're dually eligible. But if you're dually eligible and you have the waiver, you're automatically in the tailored plan. All people with the innovations waiver and the TBI waiver are automatically in the tailored plan. Think of it this way. That's the only place you get the innovations waiver or the TBI waiver is in the tailored plan. You have to be in the tailored plan to get the waiver.
Is the care manager from the LME?
Sometimes,
Could be. Yeah.
although a lot of them are outside of the Taylor plan. We are one of those Taylor plan care management providers. So we do that. And there's a number of other agencies that do. They do have staff inside that do care management, which is not our traditional care coordination. It's what we've been getting for all these years. This is care coordination that you used to get on steroids times 10. It's a whole lot more complicated. But they are inside and outside of the LME MCOs. So Alliance Partners, Trillium, and Via all have care managers, but there are also a large number of care managers outside of those organizations that you can choose from.
And you do have choice.
And you do have choice. There are over 70 community-based providers now providing care management, contracted with the LMEs to do this. And the goal of the state is that over the next 3 years, at least 80% of the care management being provided would be moved out into those community-based providers. Because the thought is you want your care manager in your community or near you so that they know the community resources, they know the providers, the doctors, the pharmacists, the dentists, the places where you can get food if you need food, the housing options if you need housing, the transportation. They know all the local resources and can more easily connect you to those resources. So the grand plan is to move all this out into the communities over the next 3 years.
So I've been told by Trillium that they're not going to contract with Atrium and Duke. My kids are seeing specialists at those two facilities, and it's not an option to move providers. What's going to happen to me on July 1?
Continue to see your doctors through Atrium and Duke, and they will be paid by Medicaid. Even after July 1, hospitals and LMEs will continue to negotiate contracts. So some of them have been a little slow. Atrium has been slow statewide, not just with Trillium. Duke signed up with Alliance first because they're right next door. They're right there in their region. They've been a little slow to sign up with other LMEs, but it will eventually happen. If it doesn't happen, you can still see your doctors and Medicaid will still pay them.
And then my adult child has to transition from pediatrician to adult practice. So we need to explore practices to find the right match of PCP provider for that condition. Does that mean we have to keep changing the PCP in the system before we go to the doctor? And is that justifiable if we have to see more than one adult PCP until we find the right provider?
That's a good question.
What I would say at this point is there's going to be an awful lot of latitude. If you're trying to find the right doctor and you went to one and it wasn't the right doctor, wasn't right fit, I haven't seen anything. And so that's something we'll have to do some research on. But I would argue strongly that this is one of those justifiable reasons. And heaven knows in our world, finding the right doctor that knows how to work with our loved ones is critical. especially given some of the complex nature of the conditions that we're dealing with, and all the co-occurring conditions, everything that goes along with that. It is vital for the outcomes of your child, your loved one, your family member, brother, sister, whoever. It is vital for their outcome to find the right doctor. And so I would, if there is a denial for that reason, again, that's something that I'll be looking into, and at least I'm sure we'll be digging into that a little deeper. But if you see that happening or it occurs to you, let us know, because we'll put some pressure from our end. It seems to me that that's something that should just be an automatic, not a problem. But what I think should happen doesn't always what happens. So, but we will definitely jump on that if we think it's happening. So please share with us if you would.
And I would add to that, whatever process your family goes through to find a doctor that meets your needs, that you feel comfortable with, that you like going to, just because the tailored plan is launching should not change your process. Stick to your process.
Yeah.
You find the person who's going to meet your needs.
Okay, let's keep rolling. If a hospital system is out of network with Trillium, could a patient elect to go with Medicaid Direct and not be affiliated with Trillium, or will Medicaid Direct still be managed by the LME?
Medicaid Direct will still be managed by the LME. You can choose not to be in the tailored plan and stay in Medicaid Direct. I'm not sure why. I don't think there's an advantage to doing that. So I'm not sure. You'd need to think through that carefully. I don't think you'd gain anything by doing that. But let me give you my building analogy to think about this tailored plan addition. Imagine that the LME MCO is a building with several floors, and on the ground floor, there's all the administrative offices and people running human resources and payroll and stuff like that. And on the second floor, there's Medicaid Direct, which is where everybody's sitting right now. Everybody's getting services from the second floor from Medicaid Direct. And on July 1st, they're going to add the third floor, which is tailored plan, a different plan that they're going to operate out of the same building. The same organization is going to operate the tailored plan. And they're going to move some of the people from Medicaid Direct up to the third floor into the tailored plan, so they have more coordinated and more tailored services to meet their needs. These are typically people with the more intense needs that are going to move up to the third floor. So all of that, the LME is still in existence. It's still the same people doing all the work. All of that is run through the through the LME. So the tailored plan is just another piece of the LME that they're bringing online.
Okay, and Becky, yeah, you had this question last week and I didn't get to it. The letter I received in the mail said there would be copays for medical visits and medications with tailored plan. We've never had a copay with Medicaid Direct before.
Yeah, I'm not sure about copays. Someone asked that in the last session too. I would call the LME and ask that question. Yeah. I'm not sure what to anticipate about copays. If there is a copay, it'll be very, very small, but typically, most Medicaid members do not have a copay.
I have my letter and it has my current and accurate doctor. Do I still need to call and choose that doctor?
I would say yes.
I would too. Yeah.
I'm surprised that you got a letter with your current doctor on it. So I would still make the choice, go through the process just to be sure, because you don't want to be assigned to someone else on May 16th.
I would say that somewhat happened to me. In my family situation, my letter did have accurate information on there, but I still called and still had to go through the process of making sure they were contracting with the tailored plan. So
Correct.
I agree.
One of the confusing and frustrating elements of this whole process is that we have been asked multiple times, and definitely wasn't part of our design. It's the way it's set up, and so part of the reason why we're doing these is to help explain things so that you know what to expect. But you have been or will be asked multiple times to sign on the dotted line, to accept and to agree and to choose, and that has happened frequently. And that's confusing because we already did that. Why am I being asked to do this again? We can't change that process, and given how this is rolled out, it's necessary. But again, if you run into problems, things you can do, you can call your tailored care plan. That's Alliance Partners, Trillium, and Via. I throw those names out because sometimes those are the names you know them by. So call them directly. You can call the state and the ombuds office that we've got the name posted up there for. Reach out and ask those questions if you're not sure. And if you have a care manager, if you have somebody you've worked with, there are a lot of agencies out there that have done this, that are in the middle of this, you can reach out and ask us. And we may, if we don't have answers, people that you've worked with generally know who to turn you to who do have answers. And the whole intent here is to make sure this is as smooth as possible for you. Doesn't mean it will be easy. And again, it would not have been our first choice to have everybody choose and re-sign every time something new comes up, but that's the nature of how things have to work right now, unfortunately.
Mm-hmm.
All right. If a doctor that's out of network doesn't agree to 90%, can I still see them?
How are they going to get paid would be my question. You can see them. You got to work that out with your doctor.
Do either of you know if UNC Chapel Hill accepts Trillium, as well as does the pharmacy there accept Trillium?
I believe UNC did sign on with Trillium, yes, which would include their pharmacy.
So somebody's asking, fair question, please provide some examples of a tailored care manager. Is a care coordinator a tailored care manager?
Let me talk about that for a minute, because here's what's happened in this. This is a huge systems change that we're going through as a state. And care management is brand new, even though it launched in December of 22. I say it's still in the infancy stage of development. Read that question one more time, Melinda.
Oh, hold on one second. Please provide some examples of a tailored care manager. Is a care coordinator a tailored care manager?
Think of care coordination, the old model we've been running for the last 12, 13, 14 years. You had a care coordinator if you had the innovations waiver. You had a care coordinator. A few other people who had some really urgent situations might have gotten a care coordinator. And what they were responsible for was a small slice of the pie. They were to assess your needs, develop a plan with you, and monitor to make sure you're getting the services that were in your plan. And that's about it. Some of them did address emergencies from time to time, but it was a very narrow scope of service. Care management is huge and broad. It's broad and deep. It can do so much more than care coordination ever thought about or was able to do by federal definition. This is all based on federal definitions. So the LMEs have taken their care coordinators and trained them to become care managers. And that is quite a cultural shift within the organization and within each person's mind. So everybody is still trying to make that shift. At the same time, let's say I'm a care manager at Via, for instance. I may be serving 60 people who are getting care management and 15 people who only want care coordination. So I'm still in my mind trying to do both. That's very difficult for staff. And some LMEs may separate that out. But what they've done in general is take their care coordination staff and train them, turn them into care managers. There's still a lot of learning going on. There's still a lot of education that needs to be done. There's a lot of experience that we all need to develop in providing this new service called care management, because it is so broad and deep, and we can do so much in that. And it's opened up the world of what we can do. When we had a slice of pie with care coordination, we got the whole pie with care management. Big difference, big service.
In some ways, the analogy doesn't work completely, but it may work somewhat for you. Care coordination is kind of like self-parking on the remote parking deck, and you have to walk a ways to get to the venue to watch the ball game or the concert. Care management is valet parking right next, next door to where you want to be. I mean, you got the red carpet, you're walking, it has everything involved. It is the full concierge service. And really their job is to connect you with what you need and to be aware of what those needs are. And it is a very tall order and it looks that way. But if you stop to think about what they're doing, if they're helping you connect with everything and making sure that your care manager or your caseworker or your day services are consistent with what you're getting at your doctor's office, and that those pieces are all connected and aligned, then the outcome for the individual is a whole lot better. The potential for better health, for jobs, for living, for housing, for transportation, all those things are all interconnected. And we know that. But rarely anywhere in the country has anybody gone through the effort to connect them all into one big piece, and not to drive. It isn't driven by the care manager saying, this is what I think you need. It's driven by the individual saying, this is what I need. And our experts, the care managers, are out there to connect you with what you're looking for.
Okay. I'm a provider, and one of the big things that we run into with the MCPs is that families often switch month to month of PCPs, and we aren't notified, which causes huge issues. Will this be the same process with the tailored plans? Specifically, will families be able to switch between carriers month to month?
Potentially, yes.
Are providers going to need to submit claims to each LME MCO via a specific claims portal, or are claims submitted through NC Tracks? I'm asking this because it has been an issue with standard plan out-of-network providers.
It's an issue with tailored plans too. They must submit their claims to the tailored plan. And this is one of the reasons why doctors are sometimes reluctant to sign up. If you can imagine a doctor's office already billing all the private health insurance plans you can think of, then the standard plans that the state has brought on, and now we're asking them to sign up with 4 more tailored plans. Each has their own billing portal, process, payment system. You'd have to hire a crew of people to achieve this just to get paid. So this is part of the reluctance. We have advocated for some sort of central portal for all of that. It's not going to happen. Providers will have to bill, and specifically doctors will have to bill through each of the LMEs.
Okay. So back to the Duke question. So for example, if Duke doesn't sign on to take Trillium, is this person going to need to find other providers to care for her son, or Medicaid is not going to pay and she's just going to have to be self-pay?
Medicaid will continue to pay.
Do Medicaid direct and dually eligible folks need to pick their primary doctors by May 15th as well?
No, only people moving into the tailored plan.
How does this impact people who have Medicaid and Medicare who pays for prescriptions?
If you have Medicaid and Medicare, and you are not on the innovations or the TBI waiver, you will remain in Medicaid direct and nothing will change for you.
This question doesn't make sense to me, so Lois, you may need to ask it again. I understand Alliance's health portal goes live April 14th. What does it include? Just maybe throw that in there again, Lois, because I'm not sure that I understand that.
And maybe I'm getting this wrong. It sounds like that's when their open enrollment begins on April 15th. It was supposed to begin April 15th. And now they're taking people in through their portal to sign up. And maybe I'm wrong on that. Lisa, have you heard anything different?
I'm not sure what the question is referencing unless it's the choice period.
Yeah.
Starting at April 15th.
My son qualifies for Medicaid, but he's also on my health retiree government insurance plan. Do we still have to choose a PCP, a different PCP? I haven't received anything from DHHS. He is eligible for 1915I. Is this too confusing?
You probably, if you haven't received a letter, chances are you're going to remain in Medicaid direct and you won't have to make a choice and nothing would change.
If though that letter came and for whatever reason it was lost or you didn't recognize it for what it is, at that point, Linda, can you pull that question back?
I
Want to
can.
make sure
It's in the answered tab at the
go
bottom.
down to the bottom.
Yep.
You shouldn't have to choose another primary care doctor, especially if they're eligible for the 1915I. That means that they are eligible for Medicaid and probably are signed up for that. You will have to choose a primary care physician, but you can choose your own. And that's kind of the essence of what we've been talking about. You don't have to lose your current doctor. The hope is that they will all sign up, but there is means to be able to address those, especially for the first 90 days. Everybody is eligible. And after that 90-day grace period, those doctors' rates will either go to, I'm signed up with an LME-MCO Taylor plan, or I will get the 90% reduced rate that they're offering for anybody that's out of network.
Just remember, only people moving into the Taylor plan need to choose a doctor by May 15th. If you feel like you're staying in Medicaid Direct, you don't have to do anything.
Yeah, and the only clue there was that they're getting 1915I services, which indicates
That's okay.
they're right there. So yeah.
Yeah, and 1915I services are a new set of Medicaid funded services that the state is in the process of launching, and they will be available to anybody in the Taylor plan or in Medicaid Direct.
All right, Marjorie asks, what are the differences in services between Medicaid Direct due to being dually eligible and on the waiting list and the tailored plan?
Not a lot of difference, Marjorie, except the innovations waiver and the TBI waiver will both only be available through the Taylor plan. So if you have a family member, for instance, who's on the waiting list for the innovations waiver, they probably would move into the Taylor plan while they're waiting for a waiver slot, and they could receive 1915I services while they're waiting. If for some reason they don't move into the tailored plan, they still remain on the waiting list and they're still eligible for 1915I services. The difference is under the tailored plan, the person's medical and pharmacy services would be paid in that managed care model by the tailored plan, just like the community-based services are. In Medicaid Direct, that all remains kind of split out separately. Still paid by Medicaid, though. You shouldn't feel any difference.
So
Here's another.
real quick, before we
Mhm.
ask this next question, we got about time maybe for one, maybe two more questions, but I wanted to pose out there before we wrapped up today and before people started dropping out. Is there an interest in us doing another edition of this particular issue on tailored care management? Basically, we've already done two. We'd be willing to do another one, but only if there's an interest in us doing so, and give folks an opportunity to go into the Q&A and offer up, yes, we would like you to, or no, this is sufficient. We just need to get a sense of how much need there is and how much concern there is. If there are things that change of significance, and there will be changes coming down the road, I expect there will be some come July 1st, we will do more of this, but trying to get some sense of what interests are there for now. And to make everyone aware, as part of what we do, we are getting ready to do a whole lot of different types of webinars on different subject matter, similar type of format, but on different subjects such as education and AEPs, guardianship, housing. There's a huge list of content that we plan on making available, and we'll do it in a very similar format. So if you're interested in this particular subject, let us know. If there are subjects that you are interested outside of this, again, put it in the Q&A, let us know, give us some insight as to what we do so that we can tailor our content around what your interests and your concerns are.
All right, let's see if we can do a couple more of these. All right, Becky asks, if I choose to go outside the LME to get care management, will the care manager, for instance, at the ARC, also do the annual ISP plan for innovations waiver, or would I still need to have a care manager at Alliance for the annual plan?
Now, the care manager anywhere would take all of that over.
In reference to doctors receiving 90% of the rate if they are not enrolled in tailored plan, is that the case for behavioral health services as well? For example, if Duke is out of network for Trillium, does Duke receive 90% of the rate for mental health services?
That's a good question. I'm not sure. I suspect that's just for the doctors, the 90% rate. In which case Duke would receive the same rate for those mental health services.
I have 3 children that are going to be on the tailored plan. Looks like 2 of my children will possibly have tailored care management in our county, and 1 has another one in some other county far away. Is there any way possible to change that? So all 3 are here local. It would be 1 child changing to the one locally. If so, how would I go about doing that?
So that's an interesting statement, because the original intent of care management was that those care managers are supposed to be local to where the services are. That's part of the deal. Is how else are you going to know what is available to that individual if you don't have some sense of what's going on in that community? So if the care manager is somewhere else, we understand that in the startup that isn't always the case, because we're filling in blanks where we can. But there should not be a problem with asking to have that care manager switch to the one that's close by. And I would certainly make that request. Lisa, do you understand anything different than I do?
I agree completely. And I would take it one step further and request that your family has 1 care manager. And I'll give you a quick example. We were doing care management for a sibling, and one of the LMEs was doing care management for the other sibling in the same family. This family had a housing crisis that the LME care manager didn't even recognize. And we were able to basically help that family prevent homelessness. And if we had been able to support the whole family, both siblings at once, it would have been a lot easier, and we would have averted that potential crisis a lot sooner in their urgent situation. It seems to me, because care management, again, is so broad, care managers can educate family members about issues related to their family member receiving services, can advocate for things that help the entire family, as long as the person is still the center of attention and the center of the plan. It seems to me you would want 1 care manager, maybe, to work with all 3 siblings, because they can address the family's needs as well. Now, you may very well have great reasons for not doing that, and want that split up, but you should be able to request a different care manager if it's not working for you.
We're at 5:30. We're
Yep.
about out of time. There is one question at the end that I would like to answer, and that is, will this recording be available after tonight's presentation? And the answer is yes. If you go to our website, on the top right-hand corner, there's a YouTube symbol. Go there, you will find not just tonight's webinar, but the one we did last week, along with other content, and not just lengthy 1-hour kinds of conversations. We're hoping to be able to break these down into smaller bite-sized pieces, topic to topic, so that if you have a specific issue and we have an answer that we've already recorded, you can just go grab that 3 to 5 minute, hopefully less than that even, answer, and just get that specific answer if that's what you're looking for. So yes, the answer is we will be putting this up on our YouTube page, and invite you to go see what's out there. And again, let us know what it is you're looking for. We know that families and parents are struggling with issues, and as we've talked through this in the recent past, we have a wealth of experience and information, and what we don't know, we have connections to people who do. And so our intent is to make sure that that gets available to the IDD community. And so we invite you to let us know what questions or concerns you have, and we'll try and tackle those.
All right. Well, I think with that, we thank you guys for engaging, for hanging with us for the whole hour. We have all of these questions. We also have your email address. So stay in touch with us, and we will get back with you soon with our next date. Y'all have a great evening. Thanks.
Thank you.
Bye-bye.
Bye-bye.